All right. Looks like we have a fairly small crowd today. I want to welcome everybody and thank you for making the effort to attend this training for the new physical medicine program for the upcoming Superior uh, Medicaid implementation. For those of you that I've not had the opportunity to meet, my name is Gina Braswell, and I am a Senior Manager of Provider Relations here at NIA. And I am also an occupational therapist. I have about 10 years experience, which allows me to share a similar perspective and assist in more of a personal as well as clinical way throughout the program. We do want to encourage any feedback or questions that you may have during this presentation. We ask so that we can respect everybody's time, that you would hold your questions until the end of the presentation or when we take a pause for questions. You can enter those questions into the chat at the bottom of the screen, and we will definitely answer those questions when it's a good time. I will be sending out a copy of this PowerPoint presentation following today's presentation. And before we begin, I just want to give a quick reminder for everyone, just please keep your microphones on your computer or your phone on mute to help minimize those distractions, the background noise. If you do need to step away for a moment, also use that mute option rather than hold, as some business phones do have background music that will play. So beyond the introductions, we'll go ahead and get started. So we'll quickly cover what today's agenda will look like, and that includes an overview of the prior authorization process. We'll talk about the clinical information required for review. We'll talk about our subsequent requests, the peer-to-peer option, notifications of determination, and we'll briefly touch on claims. And we'll talk about our comprehensive provider tools following that, as well as share those important contact numbers for you. Following that, we will walk through a RADMD demonstration of what you will do step by step when you're submitting an initial authorization or a subsequent request. And then finally, at the end, we will open up the conversation for any questions that you may have, and we'll provide those answers. So before we begin today's agenda, I do want to give a brief few details about NIA's national footprint. We have been providing client solutions since 1995, and we currently manage over 28 million national lives through 64 health plans, with about 3.5 million of those being managed by NIA as part of our physical medicine Medicaid program. In addition, our specialized teams are made up of 160 plus actively practicing physicians, nurses, as well as physical, occupational, and speech therapists. Those teams represent 28 specialties and subspecialties. And we're also proud to let you know that we're both URAC accredited as well as NCQA certified, which means that we are qualified to handle your patient's private health information. So knowing a little bit more about NIA, let's move on to the details of this specific program. The important dates to remember: beginning December 1st, NIA will be managing both rehabilitative and habilitative therapy services. That includes physical therapy, occupational therapy, as well as speech therapy. For Superior Health Plan for the Medicaid STAR, STAR Plus, non-waiver, and CHIP population. Prior authorization for waiver members is not required through NIA, but it is still required through Superior. So you want to keep in mind for your STAR Plus members, that waiver status is not designated on the member ID card. So you'll need to specifically ask STAR Plus members if they are waiver or non-waiver, and then submit non-waiver to NIA and submit waiver to Superior for authorization. So although the program start date is December 1st, you can actually begin obtaining those authorizations as of yesterday. So if you want to get some started for therapy services that are rendered on or after tomorrow, December 1st, you could submit some of those today. The settings that are in scope for NIA's management are outpatient facilities, home health settings, as well as skilled nursing facilities with the place of service 31 and 32. Again, any therapy treatment rendered on December 1st or beyond will require authorization from NIA, and you can begin submitting those today through our call center or our online portal, which is called RADMD, and we'll touch on that more in a moment as we go. The program includes management for therapy services rendered in the outpatient, office, home health, and skilled nursing settings. What is excluded from this program are the same therapy services if they are rendered in the hospital emergency department, while in the hospital with inpatient status or inpatient observation status, and acute rehab hospital inpatient as well. The early childhood intervention services are also excluded from the prior authorization program. And we do want to also emphasize that Superior's network of providers will be used for the physical medicine program. So moving on from those defining parameters, I'd like to take a look at a high-level view of what the prior authorization process looks like. So you will begin by submitting for authorization once that evaluation has been completed and you have that established plan of care. And keep in mind those designated physical, occupational, and speech therapy evaluation CPT codes, as well as reevaluation CPT codes, do not require prior authorization. That includes the 9000 series codes. However, if you build codes other than the designated evaluation CPT codes for the evaluation, or if treatment is rendered on the same day, then you will need authorization for those treatment codes that are used. And then you must submit that within 3 business days, and NIA can backdate to cover those treatment codes. So the most preferred and efficient way to submit those authorizations is, again, through our online portal, RADMD. We also have the call center available. Faxing is an option, but again, the preferred and most efficient way for providers is to use these 2 options. You'll be instructed to submit clinical documentation on each request, and that documentation will then be reviewed. And once that decision is made, if there is an approval, services can be rendered. And then claims will continue to be submitted to Superior just as they are today. So in light of the decisions that I just mentioned, I'd like to take a quick dive into the clinical foundation for those decisions. Here at NIA, our goal is for members who need therapy to get the appropriate quality services that they need at the right time. So those authorizations are issued in accordance with our internally developed medical necessity guidelines, which are mutually approved by Superior and NIA's chief medical officers and senior clinical leadership. They're based on evidence-based research as well as best practice guidelines from our national therapy organizations. In addition, we use the Magellan Care Guidelines, or MCG guidelines, as well in the review process. And you can access all of those guidelines on our website, RADMD, without having to obtain a secure login. So if those need to be shared with a therapist who may not be submitting for authorization, those can be easily shared. The peer-to-peer discussions are offered For any request that doesn't meet medical necessity guidelines, therapists can and are encouraged to have a peer-to-peer discussion with the therapist reviewer. However, keep in mind, re-review is not available for the Superior Medicaid program. So these would be more for consultation. If an appeal is initiated, that will help in understanding what's needed to meet medical necessity criteria. So at this point, it's important to know what clinical information is required for the medical necessity review. Um, each request will append at intake for this clinical information. So some of the general information that's needed is who the patient is, who the treating therapist is, the facility information, the ordering physician, some of the clinical information at intake, those pertaining to the authorization details, such as the start and end date of the requested services, the date of the initial evaluation, the number of visits being requested. And for Superior Medicaid, you will have to attest whether or not the physician's order has been obtained. You do not need to send that to NIA, but make sure that you have that as part of your medical records if there's any audit from other regulatory entities that require it. So as far as the clinical record content, the information would need to include the initial evaluation on those initial requests, and that should include a comparison of the prior and current level of function. It should include functional deficits. It should have objective test measures for all skills that are addressed in the plan of care, and then a plan of care that specifies that frequency and duration requested, as well as the goals. Keep in mind that plan of care, the frequency, duration needs to match the physician's order as well. This screen has a summary of the clinical records checklist. And to sum it up, we're only looking for the minimal amount of clinical information that should support the medical need for therapy in order to save you time, as well as our reviewers, in getting that decision back to you quicker. So what that includes is the initial evaluation. Once that has been sent, it is accessible by our reviewers if subsequent requests are initiated as well. So you only need to send that once. And then if additional visits are requested beyond the initial, you will want to send the most recent overall progress toward the goals since visits have been used. Doesn't necessarily have to be a formal progress note, as long as it includes that overall functional progress toward the goals and the benefit of therapy. And then you'll want to include 2 or 3 of the most recent daily notes, which should demonstrate those skilled treatment techniques or interventions that are being used in treatment. And there is a small difference on habilitative cases in comparison to rehabilitative. Habilitative is generally longer episodes of care. And for these types of cases, annual testing is required. So if the episode of care has lasted more than a year, it's habilitative care, then you would need to send at that point the most recent reevaluation, as well as the most recent progress note and 2 or 3 of those most recent daily notes. So, and you can access this information on our online portal, and I will go over that here at the end. So when clinical information is needed, you'll receive a fax like the image here that details what information is needed to support the request. And you'll also receive a fax, a member-specific fax cover sheet that you would want to use if you need to fax that information. It has an electronic number where our system will recognize it and send it straight where it needs to go. And if you were to use a custom fax cover sheet, there would have to be a manual intervention, and then the time required to figure out where it needs to go. So the best, most efficient option is to use that member-specific fax cover sheet if you need to fax information. And you can get that through our call center, but also it will be sent if additional information is requested. The determination timeframe begins after receipt of clinical information. And as well, if clinical information is not sent, that will likely result in a non-certification. So if clinical information is needed, again, the best and most efficient way, the preferred method is through RADMD. And as you can see here, this slide shows that once inside the authorization, you have the option to either print that fax cover sheet or upload clinical documents. You'll simply find the documents that match the file formats, and you'll get that immediate confirmation if you upload documents through RADMD. If you're unable to use RADMD, you can either, to upload, you can either print the fax cover sheet or obtain one by calling our call center and they can fax that to you. And make sure that is the first page of your clinical documents as well. So now that we've covered some of the individual steps of the process, I wanted to go over a more in-depth summary, if you will, and bring it back to a bigger picture. You'll begin by contacting NIA, again through RADMD or the call center. Those are the preferred and efficient ways. You can fax, but again, RADMD and our call center are the preferred methods. You'll enter in the member information, the ordering physician's information, as well as the clinic where treatment is going to occur. And then that case will pend. All of the cases that are submitted will pend. You'll be given a tracking number similar to what is on the screen. And then you'll be required to upload that clinical information. So be sure to have that ready at the time that you're requesting those services. That turnaround time for Superior is fairly short, so you want to have that available at that time. At that point, the documentation will be reviewed and you'll either receive an approval, you'll get that authorization number at that same time and a notification with the number of visits as well as the validity period. If that request does not meet medical necessity, there will be an adverse determination and you'll also receive a notification at that point. Keep in mind that peer-to-peer option is available to ask questions and understand the rationale and what might be needed in order to meet medical necessity. The general turnaround time for those requests is 2 to 3 business days, depending on the member's plan. So while using the authorized visits, if the therapist sees a need for ongoing care, you can initiate what we call a subsequent request. This can also be done if there's a new diagnosis or any change that would warrant more visits. And that subsequent request can easily be made on RADMD as well, with uploading the clinical documents to support it. You'll need to, again, specify the start and end dates for that request, as well as the number of visits. And this can be done, or needs to be done, excuse me, while the previous authorization is still active. So if that previous authorization has an expired validity period, you will actually need to initiate a new request at that point. If the subsequent request is approved, those visits will build on the original authorization. And keep in mind, for Superior Medicaid, and if you're familiar with the Ambetter from Superior program, this is a bit different. So keep in mind that the previous authorization validity period will be automatically ended prior to the new requested start date on those subsequent authorizations. So any unused visits would be forfeited. So you'll need to make sure that you have those visits in mind, as well as the start and end dates of each authorization. If medical necessity is not supported for continuation of care, a 15-day notice of pending adverse determination will be given to transition to a home program, and that will be 15 days at the requested frequency and duration. So as you know, sometimes things are not as cut and dried, and this slide covers what steps to take if care is needed for a different body part or a new injury while the patient is already receiving therapy services. So if treatment is already occurring and there's a script for a new body part or a new injury, you'll go ahead, perform the new evaluation, develop the plan of care, and then submit that as a subsequent request to the current authorization. And a new authorization is not needed if that care is ongoing. On the other hand, if care for the previous body part is being discontinued, you would submit that as a new request for the new diagnosis. You would want to include the discharge summary with the end date for the previous episode, and then NIA will end the previous authorization and begin a new one if that criteria has been met. So now that we covered the authorization process, there's two types of notifications that you'll receive. And the approval notification will include the fax cover sheet if information needs to be faxed. And also it will include the number of visits approved along with the validity period. The denial notification will include any explanation of the denied services as well as the clinical rationale of why that decision was made. The 15-day notice of pending adverse determination will also be sent with that notification, which allows, again, those 15 days of treatment at the current frequency to transition to a home program. As mentioned previously, the peer-to-peer option is available and can be initiated for consult only in order to discuss the reasons and provide any details that would be needed to meet medical necessity. And in the event of a denial, you would need to follow the appeal instructions provided in that denial letter. So as far as claims, you'll continue to submit claims to Superior. Using EDI for claim submission is strongly encouraged. And in the event of a prior authorization or claims payment denial, the decision can be appealed through Superior. Providers should follow the instruction on the non-authorization letter or explanation of payment notification. So with this new program, there's a few points that I want you to keep in mind. If there are multiple disciplines that you're requesting services for the same member, a separate authorization is needed for each discipline. So if a member needs OT, PT, and speech, that would be 3 separate authorizations. The initial evaluation as well as re-evaluation CPT codes do not require authorization. However, if treatment is performed on the same day as the evaluation, or if codes such as G codes or S codes are used for the evaluation, those codes do require prior authorization. So after that initial visit, you have those 3 business days to request approval for the treatment services that occurred, and we can backdate those 3 days to cover those treatment codes. Subsequent requests are added to the initial authorization, and they do require updated clinical documentation. And an authorization will consist of the number of visits and the validity period, and each date of service is calculated as a visit. And due to, I understand that providers are used to 4 billing units. Keep in mind that the maximum units per visit is 4 units. And let's talk about our provider tools. So as we've discussed several times in this presentation, our secure online portal, RADMD, is the engine behind making the authorization process easier and less time consuming. You can make requests 24 hours a day, 7 days a week for greater convenience. There may be rare occasions after business hours where maintenance occurs, but again, that is rare. But using RADMD will save you time, decrease the administrative burden of calling or faxing information. And what you'll find, you can request authorizations, you can view and manage them, you can upload clinical information and get that immediate confirmation. You can see all of the documents that have been uploaded to the case, as well as all the NIA documents that we have sent regarding the case. You'll have access to the clinical guidelines, and all of the educational resources will be available on RADMD as well. If you're unable to use RADMD, we do have the call center that is available during business hours at the number listed. And then as far as registering on RADMD to gain access, I want to first mention that everyone in the clinic will need to have their own username and password due to HIPAA regulations. And you'll simply, on the home page, there's a green box. You'll select New User, which will take you to an account for application or application for account. And you'll select the best option from a drop-down box that describes your company. So even if you are one who does billing or submits authorizations, you will still select physical medicine practitioner to best describe the company. Some providers end up choosing facility or office where procedures are performed, and this is actually a different type of access that will not allow you to initiate authorization requests. So you'll select physical medicine practitioner, fill out the application below with your information, your supervisor's information, and within 1 to 72 hours, and you'll get an email. Typically, this happens while I'm still on the phone with the provider if I'm walking someone through the steps. So it's usually fairly quick. You'll get a temporary password where you can go and create a permanent password, and then you have access to all of our online resources. And we are continually looking to have better ways to serve you. And in response to provider feedback, one of our newer features is our shared access feature. You can see under the admin section here is how you access that. And what that is when you have someone in the office who may be out of the office, or you just simply need to view and manage each other's authorizations, you can share your access. And we'll walk through how to do that at the end of our presentation as well. And that will allow you to communicate with those in the facility and continue managing those authorizations if someone is out of the office. So going through this new process, there may be times arise when assistance is needed, and these are the ways that you can contact NIA to initiate or check the status of an authorization. You can do that with your RADMD access, and you'll have all of the authorization details at your fingertips, or you can also check status through the toll-free number that's listed on the screen. There is also a peer-to-peer number that's listed here. I do want to mention we are in the process of making changes. So you can also reach out to the call center number listed if you need to initiate a peer-to-peer request or discussion. Below is the email address. And if you were to have technical issues, as well as the provider service line. And then finally, I am the dedicated provider relations manager for this new program, and you can contact me through the numbers listed, as well as email. I am on and off the phone quite a bit. So if I'm not able to answer, definitely leave me a message with a good callback time, or you can also reach me by email. So that sums up this part of the presentation. It was a lot of information. Are there any questions at this time? I'll take the silence as a no. Let's see, let me get up my demonstration here. All right, so you should be able to see the RadMD homepage. Is that what everybody can see
Yes.
at the moment? Thank you. Okay, so this is, if you go to radmd.com, this is what you will see. And on this page, if you have not used RadMD before, you would simply select New User. I'll walk through this really quick here. And this is the drop-down box, the application for a new account. You'll select from the drop-down box, physical medicine practitioner, again, that best describes your company in order to have that correct access. And you'll fill out the information for yourself, as well as the information for who you report to directly in case you were to ever leave the company. That way that access can be terminated at that point. And then once you submit that information, you'll receive that email with a temporary password. I wanted to show you real quick as well, while we have this open, some of the resources that are available. Again, everything on this homepage, you do not need a secure login. So if you have a therapist who needs clinical, well, you'd like to share the clinical resources, you can do that on this page. We have a news and alert section for anything new pertaining to the program. There are more online tools where you can access the physical medicine guidelines. And then there's a reference section, which has RadMD resources that you can also check. But the one place I wanted to show you, this solutions tab at the top, if you hover over that and then select physical medicine, this will take you to all of the physical medicine general guidelines. So you'll have your outpatient habilitative, PT and OT, you have habilitative speech. Record keeping and documentation standards is another one that's very commonly used. So there's quick access to these. Actually, what you have below, this would be for your superior health plan clinical guidelines. These are health plan specific. So actually your therapist would access these rather than the ones above. So that is a quick way to access clinical resources. And the other way I wanted to show you, let me go ahead and log in. When you log in, you'll enter in your information, you'll select OK on that security disclaimer, and this is the main menu page. So the other option for health plan specific educational documents is at the very bottom on the left. So you'll click this link, and on the left-hand column is all of the health plans. For Superior Medicaid, you'll select Centene Superior Health Plan. And these are all of the documents for this Medicaid physical medicine program. You'll have the frequently asked questions, the quick reference guide, the PowerPoint we use today, the guidelines, as well as the superior specific tip sheet. On this page, you'll also have a recording. It will be added most likely today of this training, and you can access the clinical guidelines here as well. So those are a few points of wanted to show you as far as accessing the resources. Any questions on that information? All right, so what we'll do next, I'll take the silence as a no. We'll walk through a demonstration of how to submit an initial authorization request. And I believe you should be able to see again the RadMD homepage. And what you see here includes the main menu. Let's see. You have 3 sections. You have a request section, a search section, and then resources and tools. And under the request heading, up here on the left, you'll see the physical medicine link, and that is what you'll use to initiate a new therapy authorization. Below that is initiate a subsequent request link, and that is when a member has a prior authorization and there's a need for additional visits or a new diagnosis that is being added. So let's initiate a new authorization. You'll select physical medicine and you will be asked to enter the member's name, the date of birth, select the health plan. Member ID is optional, so you'll click save and continue to step 2. And on the next screen, you will actually attest to whether you have the signed physician's order for the therapy services for that member that is consistent with the intended therapy plan. And as mentioned earlier, you do not need to include that in your documentation sent to NIA, but do include that in your own medical records if there were an audit by any of those regulatory agencies that require it. So next you'll be asked to enter in the ordering physician. So this is the physician that has ordered the services. You can use any one of the search options. Here we use the MPI number. And then you'll select the ordering physician from the options below. On the next screen, you will enter in the therapist's name. That is most likely going to be the therapist that performed the initial evaluation. This is for NCQA requirements only, and it's to include that name on the notifications. It's not associated with billing. So that is the purpose for requesting the provider, the treating provider therapist name. Following that, you'll be prompted to select the clinic where the therapy services will be rendered. If it's home health, the home health agency that is associated with the services. You'll enter any one of those fields and select the appropriate one, verify the tax ID number, then you'll enter in the place of service, the cause of therapy. You can enter up to 5 ICD-10 codes, only one is necessary, and you'll designate a primary code. The discipline, there's 3 questions regarding the primary payer. They do default to no, so make sure you read through those. And then you'll be prompted to enter the start and end dates, as well as the number of visits that are being requested. And that start date, remember, keep in mind that will automatically end the previous authorization and any visits will be lost. If this is an initial request, you want to make sure that that is beyond the 3 business days. If it is beyond the 3 business days, you'll need to remember those. If you have treatment codes that need to be covered, it would need to be within 3 business days. On the next screen, you'll be prompted to enter in a contact name and number if there's any questions regarding the authorization, and then a fax number and confirm that as well. This should actually be the ordering physician's fax number for Superior Medicaid program. And then there is a paperless option. If that is desired, a email will be sent to the email address that is listed on your screen. It does not contain any private health information. It is simply a link to be able to access that authorization in RADMD. You'll enter in the initial evaluation date. It's recommended if that date was 2 or 3 years ago for that initial evaluation, that is the date that NIA is looking for. So after you enter that information, you will see that the request has pended. It will append for clinical information. You have information regarding the patient, the ordering physician, as well as the facility. And you will need to upload additional information at this time. You can print this page for your records. You can print a fax cover sheet if you need to fax the clinical information, or you can select to upload additional information, which we'll do in this demonstration. You'll select that button. You'll also click Upload Clinical Documents. Then you'll just find the file on your computer that matches any one of those file formats that are listed. And you'll see once you select the appropriate documents, you have an immediate confirmation. And then you'll attest that all of the documents have been uploaded. And it will take you to the verification details page, where on this page, you'll be able to see the authorization number, tracking number, the status as well. So that ends that demonstration of how to initiate a new therapy authorization. Any questions on those steps? Got a quiet bunch today. If you do have any questions, don't hesitate to speak up. And what we'll walk through next, the last demonstration will be how to initiate a subsequent request.
Gina, there's a question in the chat from Angie.
Oh, great.
And that's what documents are needed to submit just the plan of care?
Very good question. Yes, so if it is an initial request, you will want to actually submit the initial evaluation and the plan of care. If that's a subsequent request, you'll want to, you don't need to send the initial evaluation again, but you'll want to send any progress since those last visits were approved, overall functional progress toward the goals, and 2 to 3 daily notes that would help demonstrate the skilled interventions. All right, if there's no other questions, we'll walk through how to submit for a subsequent authorization. So here, this is zoomed in a little bit more, but under that request heading on the main menu page, you'll initiate a subsequent request by selecting that same link, initiate a subsequent request. After that, you will search for the member by entering in any of the search options on the screen. You can also select from the members at the bottom of the screen, and there's an option at the top to view all my online requests. If you select view all my online requests, it will take you to a page that shows all of the ones that you have submitted through your BradMD access. So once you select the member's name, you will actually go to that request verification details page. And at the top, you will see the button to request additional visits. You'll select that. And on the next screen, you'll select additional visits, units request. You will want to confirm the discipline, and you will also be prompted for the start and end dates on this screen as well, plus the number of visits being requested. You'll confirm everything and then click Create Request. And at that point, remember, all subsequent requests will require clinical documents to support the requested visits. So that's all there is to the subsequent request option. So going back to the main menu page, there are 3 options under the search heading where you can search for an authorization by view request status. You can search by the tracking number or view all online requests. And what we're going to walk through now is if you select view request status, Again, you can enter in any one of the search fields, member name, the member ID. The authorization number is the same as the request ID, the tracking number, or the request date. You can select view all of my online requests, and once you have the options below, you'll select the appropriate member name. And once you do select the appropriate authorization you're looking for, on the next screen, you'll see the options again. You can print the page for your own records. You can upload the clinical documents. You can request those additional visits. Um, this screen shows there is an option to request a validity date extension that is not available for the Superior Medicaid program. On this page, though, what you do have details to, you'll have the authorization number and tracking numbers, the status, the validity period. If you scroll down, you'll see the color-coded row that summarizes the authorization as well. If it's green, that means it is approved. If it is yellow, that means that that request is in review, and red means it's been partially or fully denied. You can also see the number of requested visits and visits approved on that page. If you continue to scroll down on that page, you can find all of the documents that have been uploaded for the case if you need to confirm something, as well as all of the notifications that NIA has sent regarding the case. All of that will be available to you. So we'll go back to the main menu. The last part of this demonstration is to show you the resources, and we did touch on some of them, so this will be fairly short. In order to share access, again, you'll select shared access under the, actually it's resources and tools section, and you'll enter in your coworker's name. Coworker must be in the same facility. Their username for RadMD as well as the end date. There's a 90-day maximum. You'll hit send share offer, and they will receive that when they log in. They'll have that pending request. Once they accept or decline, you will see that if it's active and accepted, you'll see it in your active shares, and it can be renewed or canceled at any time. You'll be able to see each other's authorizations through that feature. And then next, you'll have the health plan specific guidelines. Again, under this section, you'll click clinical guidelines. You will select the health plan. From this page, you'll have access to all of the guidelines as well as instructions for how to access the MCG guidelines. And the last one is that health plan specific educational documents page. That is the one where you'll find everything you need for the new program. So you'll select health plan specific educational documents and the health plan from the left, and then you'll see all of those documents on this page, as well as the clinical guidelines, a recording of today's training, and anything that you might need. And that concludes our demonstrations for today. So I do want to ask, are there any questions? That's a lot of information we covered. What questions do you have?